Welcome back. We're covering this year's legislative session in Tallahassee with two state senators who were in the middle of it all, Republican Ana Terry Flores and Democrat Jose Javier Rodriguez. I want to turn to health care because there was a lot that was done. This was the priority of the House Speaker, Jose Oliva, was to do some health care reform. Give me your general take on health care reform. Let's start with you.
Well, certainly I would say it's an issue that dominated session because, as you mentioned, Speaker Oliva made this a priority. So we tried to pass bills to find ways to actually lower healthcare costs, lots of different things. So one of the biggest things was to eliminate what's known as the Certificate of Need program. So currently when a hospital needs to be built, they need to make their case to the state that there's a need for it in that area. Some would say that has stifled competition, and so essentially the state of Florida, we said within the next 2 years that will be gone, and we will let the market drive whether or not a hospital is needed in the area.
So let's stay with that for a second. Is that a good idea?
Well, listen, it depends on how it's done. I think that a lot of the discussion during the legislative session was exactly what that process would look like, how far it would go, specialty hospitals especially, because, for example, specialty hospitals was one of the more controversial things because, children's hospitals, particular needs that are met, it's hard to have a free market in completely unregulated, partially because they require so much of an investment in being able to build up that capacity. And so it's all about how it's done, and it's about making sure that, as Senator Flores said, the driving thing really is about cost. But we can't reduce cost too quickly at the detriment, frankly, of access to care.
I want to talk about prescription drugs just briefly.
Absolutely.
Did you both vote for that, or how did you vote for it? You voted yes?
Yes.
I ended up voting no because it was frankly kind
This was
of
the idea, we
yeah.
just sort of set it up.
Right.
This was the idea of being able to purchase prescription drugs from Canada in bulk. There was a lot of commercials that were being run that was suggesting that you don't know what you're actually going to buy. You could be getting black market drugs from China, from other countries, and so it was posed as a possible threat to folks here. The Trump administration just signaled this week that they're going to work with Florida to try to implement it. Why is this a bad idea to lower costs? Aren't a lot of people trying to get their drugs from Canada?
Yeah, no, so I think we should be doing things to reduce costs, and that's one of the biggest problems that we've had that's really frankly been undealt with is drug prices, healthcare prices generally. This bill, frankly, even the sponsors of it, basically we're saying this is an optics bill, that it didn't really accomplish anything.
Well, it doesn't accomplish anything unless the federal government helps, and the president said he would help.
I'd say that the federal government has come out very strongly saying that this is something that they're supportive of. I'm happy to be working with Florida, such a very large state, that would be the first place to implement this. And there are sufficient safeguards in the bill to ensure that any pharmaceuticals that would be coming from other countries would be safe, would be tested, would meet the same standards, but that they wouldn't be as costly as they are here.
I want to stay with you for a second. You had a big win. You proposed a piece of legislation this year to try to bring some sanity to the cosmetic surgery boom that takes place here. Your bill passed. Talk a little bit about that.
We did. We passed this bill unanimously, which I think was a very big win. Unfortunately, there have been a series of deaths that have happened here locally from people coming from across the country to South Florida to get different type of cosmetic surgery. This was an industry that was virtually absolutely unregulated, and so you had some very bad doctors continuing to be able to exercise even after they had essentially murdered patients.
They would actually have their clinics would be shut down. They would reopen the next day under a different name for the clinic and just keep going.
Exactly. So we shut that down, and now the law says that first of all, there are going to be a lot more regulation, a lot more inspection, and the Department of Health will have the tools necessary to be able to shut these clinics down. And if they do shut down, nobody at that clinic could open up for at least another 5 years somewhere else.
Your take on it? Good?
Yeah, very good. And one of the other things is, unfortunately, the Senate confirmed Mary Mayhew, which is DeSantis's pick for Agency for Healthcare Administration. But that's a healthcare topic.
Yeah.
And
No, go ahead.
Super important. She was in Maine before being basically doing the same job, and was at the Trump administration for like 3 months before being picked here. And it's hard to find someone, if you do a national search, that had a worse track record. Very ideological tenure in Maine, and resulted in infant mortality rates going up. Of sort of the only state where you really had a lot of federal audits, even state audits. And it's strange why Governor DeSantis would want to invite her to come here to Florida, where our population is so much bigger and more complex.
Well, I'm going to put a pin on that because I want to get to a couple other things.
Sure.
I want to talk about the firefighter bill.
Yeah.
This was another area, another win for you. This was a good session for you, Senator Flores. It's nice to be in the majority, isn't it? You know, but this this was a bill that was held up in the House.
Yes.
You know, I think there was a lot of public pressure. We devoted an entire show to the issue of why the Speaker was not allowing a bill to grant just some financial relief to firefighters who develop certain types of cancer that are almost certainly job-related. It was held up in the House. Eventually, public pressure, Oliva passed it. It passed unanimously in the House, passed unanimously in the Senate.
Yeah.
This is a good day.
It was, I mean, it was an incredible win, and really this would not have happened but for the incredible advocacy that started with our own local firefighters. So a shout out to Omar Blanco, the president of our local firefighters union, who did not give up and said, we are going to pass this, despite, unfortunately, the political pressure that I know you documented so well on the show. But ultimately, the right thing happened. The bill passed unanimously, both in the House and the Senate. And in fact, the governor signed it before session even ended.
So let's end on a controversial note. Instead of ending on a positive note, let's end on a controversial note. The Sanctuary Cities bill.
Yeah.
You know, you were the only Republican who voted against it. I know all the Democrats voted against it. Why did you vote against it? Why did you break with the party on this?
Okay, so, you know, it's one thing to say, I mean, nobody is in favor of having dangerous illegal immigrants in our country or in our community. Nobody's in favor of that. And if the bill would have done just that, I think you would have found a bill with unanimous support. Unfortunately, that's not what this bill did. Really, what this bill did was really just send a very broad negative message that essentially immigrants and certain immigrants are not welcome in our state. It's something that we already know is going to have an incredible, huge economic impact, and it's a lot further than what the sponsors said it was. And so I just don't think that we should be sending that message to our community, especially such a diverse community such as ours.
This bill has been tried for 10 years. It never passed before. Is this the culmination of Donald Trump and first Donald Trump, then Ron DeSantis winning the governor's race, sort of taking over the state political machinery here?
Yes, it is, unfortunately. So again, it's a very sweeping anti-immigrant bill that loops in local and state governments into basically acting as ICE. And the interesting thing, you led with saying that the legislature is moving us to the right. And 8 years ago, and Senator Flores was consistent in her positions, 8 years ago when we had a brand new Republican governor that won his primary, being anti-immigrant, Governor Scott, he tried basically the same thing, and he was stopped in the Senate when there were less Democrats at that time. And this time around, they just railroaded it through, and primarily, again, we have DeSantis. He launched his campaign on this anti-immigrant stuff, the same as Trump. And frankly, I think it's a changing Republican Party. It's less conservative, and people don't like it when I say this, but more nationalistic, and it's very dangerous, I think. And I think that really where this kind of stuff comes from, it's not good. It's going to have a real impact on people's lives.
5 seconds. I'll give you the last word.
No, I mean, I'll say, look, I think ultimately, I'm a Republican. I will continue to be a Republican because I do believe we need to return to those Republican values of ensuring smaller government, family first. That's what I hope that we continue.
All right. I want to thank both of you. We didn't get a chance to even talk about the environment. We'll save that for another day. All right. We'll be right back after the break.